commissioning of healthcare is something I'm incredibly passionate about, and I hope I'll be able to share that passion with you this morning. But as Martin's already said, I'm very aware that we're amongst experts, and I know that you'll have lots of areas of good practice. So please do actually share that with us during the chat box or during questions, or tweet us as well. We've got a bit of a Twitter chat actually going on using CYP Voices as well. So if you're into Twitter, then please do tweet as well. So just taking us through our slides. As a children's nurse, I love stories. So I thought I'd share Tinus's story. He's in the middle of the slide here with a few other people. And Tinus just happens to have brittle bones or osteogenesis imperfecta for those clinicians on the call. Tinus is 20 now, and he very kindly co-chaired a meeting with the Care Quality Commission, the Royal College of Nursing, the Royal College of Paediatrics, all the great and the good, about a year ago. And to be perfectly honest, I can't remember anything that was said at that meeting that was of any great significance, apart from Tinus at the very end of the meeting, who said, "In my 19 years of using NHS services, no one has ever once asked, what matters to you, Tinus? What's good? What could be better?" And he said, "I've used A&E services, inpatient services, GP services, specialist services. No one's ever asked about me." And I suppose that's a bit of a plea. We can involve children and young people in their own care, but I'm not sure that we actually do it consistently. But we could do even better by actually involving them in commissioning and at a more strategic level as well. So what are the drivers then for actually involving children and young people and families in commissioning? Is it the right thing to do? Is it a legal requirement? Or possibly, is it both? So I'm going to get you involved now, if I possibly can. So Martin is going to actually pop up a poll, and we'd like to get you clicking. So you should be able to see that question in front of you. What are the drivers for involvement of children and young people? Is it the right thing to do? If you think it's the right thing to do, click on A. Is it a legal requirement? Click on B. Or actually, is it both? And there's a submit button at the bottom of the poll. So if you could actually click on the answer that you'd like to make, and then submit, that would be really helpful. And in the meantime, you can actually have a look at that commissioning cycle that's actually in front of you, and think about perhaps how do we really begin to involve children and young people in the planning relating to commissioning, in the procurement of our services, and also in the ongoing monitoring processes as well. So it looks as though lots of people have actually got involved and actually made their comments, which is really fantastic.
92%, Kath. Better than the election.
92%, brilliant. Okay. So what's our overarching answer? Everyone's actually saying both. Is that right? We've got some that say it's the right thing to do, but the vast majority of us are actually saying it's both, which is really helpful. And interestingly, when I was chatting with children and young people a couple of weeks ago, it was Ellen, who's a 14-year-old with diabetes, who actually said, don't just engage us when it's convenient for you. Actually, we want to be engaged from the start of the process and throughout the process as well. So that was her plea, that sort of, it needs to be consistent rather than tokenistic. So if we actually look at the policy background, and I'm just, Martin, I think you've still got control actually, so I don't know as to whether you could move us on to the next slide, if that's possible.
I think it's back with you, Kath.
Oh, there we go. Lovely. I'm ever so sorry. Thank you for that. So the policy background really actually drives us and provides us with both the legal context as well as the ethical context as well. So if we look at the Health and Social Care Act of 2012, that stated very clearly that the public have a right to be involved not only in their healthcare personally, but also in shaping services, and that includes the 12.4 million children and young people that we've got across England. We've then got the UN Convention on the Rights of the Child, which we actually signed in 1991, and there are a whole variety of those articles within the rights that relate to healthcare, whether it be Article 12 about participation, Article 13 about the right to information, Article 23, the right for disabled children to actually have a voice and to receive the best healthcare possible, and then Article 24 about providing all children with the best healthcare possible, and particularly Article 31 about the importance of play as well, generally, but also specifically from a healthcare setting as well. We've also got the Children and Families Act of this year, specifically Section 19 that relates to our children with special educational needs and disabilities. And then last year we actually had the Chief Medical Officer's report. It was written during 2012 and actually published last year, which highlighted Chapter 4 about the importance of actually children being involved in their health care and really having a say. And the whole of Chapter 4 is actually related to that, which is a really good read if you haven't had a peek at that as yet. And, of course, critically, we've got the cultural shift that we've actually seen with the Francis inquiry and the report, really emphasising the importance of experience of care. So for clinical effectiveness, when we actually look at the quality domain, we've had NICE for a number of years. The safety, we've had the National Patient Safety Agency, which now their work actually sits within NHS England. But we haven't had as much focus until recently about the experience of care. And I think it's only by involving children and young people and families in their care and in commissioning processes that we can really begin to understand what really matters for them. We did a survey of organisations in August of last year. Only 40% of organisations had a definition about what experience actually meant. So I've adapted this one from the Beryl Institute in the States, which has got a phenomenal amount of resources relating to experience of care. If you haven't had a look at their site, it is well worth actually peeking at it, saying that children and young people's and families' experience is the sum of all interactions, and it's shaped by an organisation's culture that really influences their perceptions right across the whole continuum of care, which really begins to give us a foundation now. We've got that statutory requirement, we've got the ethical requirement, but also critically as well, there's a biological impact. We know that children gain great confidence in actually participating, and it has a physiological impact in terms of actually reducing cortisol levels and actually increasing endorphins as well. So it's a bit of a win-win for everyone if we really invest in this. But I suppose there's a significant complexity around children and young people's commissioning. It's not just one simple group. We've got our neonatal cohort, we've got our younger children. How do we actually involve them specifically in processes? We've got our young people and ensuring that they're actually receiving age-appropriate care, and then also involving children as children's families as well. The Council for Disabled Children did a really interesting piece of work recently that specifically asked children what mattered to them, children with complex needs. And for them, their number one priority was management of pain. And when they asked families what mattered to them, it was access and actually having coordinated appointments. So very different perspectives. And I suppose our priority has to be on those who are seldom heard. And who are they? So I'm going to encourage you to actually go into the chat box, if you possibly can, and actually think about who are those children and young people whose voices are seldom heard? Are there groups that you've actually done some specific work with? So if you can take a moment to actually type in some of those groups, it may be, for example, young carers. We've got around about 700,000 young carers across England. How are we engaging with them about their care? We've also got children and young people who are in care, who are looked after. We've got gypsy traveller communities. We know that our black and minority ethnic children and young people repeatedly report poorer experiences of care. We've got specific communities then, for example. I know that Luton have done some great work actually with Somali communities and doing some specific outreach work. So there may well be a whole variety of other groups that you're actually capturing. I can see that sort of Catherine's actually highlighted from Torbay, disabled children and children with complex needs as well. There we go. Martin's just reminding, don't forget to choose everyone to actually send your messages about who those vulnerable groups are. So I suppose it's actually going back to our joint strategic needs assessment and actually saying, who are those groups that have actually been highlighted within those plans that we really do need to actually reach out to? And then we do have a whole variety of insight tools. From April 2015, we'll actually see the Friends and Family test being applied to children and young people. We've got patient-reported experience measures that are available on the Royal College of Paediatrics and Child Health website to capture children's experiences. We've got the National Inpatient Survey that's currently out in the field. We'll have the results in May from the Care Quality Commission and PICA with regard to that. And then we've got more local activities, so focus groups, youth groups, the use of social media, capturing compliments and complaints. They all actually provide us with a rich variety of data, and it's great to see so many vulnerable and seldom heard groups actually coming through here. So yes, David actually highlighting young people who are rescued from trafficking, those people going through transition. Thanks ever so much for actually highlighting that, Gina. Siblings, absolutely, often a very forgotten group. Thanks for that, Hazel. So some very brief examples then of good participation. What we've actually seen nationally is the establishment of the NHS England Public Health and Department of Health NHS Youth Forum. We wanted to be able to role model to the country that NHS England was actually taking the voices of children and young people very seriously. And can anyone spot Simon Stevens on this photograph as Chief Executive of NHS England? He's in the second row, bang in the middle, kneeling down, actually totally involved with a really mixed group at our NHS England Takeover Day event that we actually held in November of this year. And then we've got some clinical commissioning groups, such as Shropshire Clinical Commissioning Group, who have actually established young health champions. They've now got over 100 young people actually working with them to help them in their commissioning, but also in their ongoing monitoring of services as well. And then we've got a huge amount of energy out in the provider landscape as well. So East and North Hertfordshire have recruited over 650 young people as trust members, and they are all undertaking specific projects under that piece of work. Blackpool actually use young people to actually train their medical staff at induction as well. So there's a huge amount of good work actually happening out there in practice. And I think that actually brings us to our very brief overview that gives us an opportunity for questions. So I'm going to hand back to Martin as our chair.
Thank you very much, Kath. There was a round of applause from my end here. Thanks for that really good overview, and thank you so much to everybody else in the room for participating with your ideas. We've set aside just 4 or 5 minutes here for questions, primarily for Kath, I would guess. So please either just put them in the chat box and send them to everyone if you like, or to me as host, or raise your hand and I will ask you to ask your question. And I apologise at this stage if the choosing is a bit random, but because it might be alphabetical, it might be the first hand I see. But if anybody's got any questions or anything they want to add.
I think it's really helpful, actually, Martin, just reading the chat box that Heather has very kindly actually highlighted that often the parents of really young children are actually left out of commissioning and in terms of the design cycle, and we need to ensure that they're not forgotten. And I think we need to get out of our comfortable clinical environments sometimes, whether that be offices or whether it be hospital environments or whether it be clinical outpatient environments, and actually go into children's centres and go into local community centres and actually sit down, have a cup of coffee, piece of cake in a really relaxed, informal environment. Engagement doesn't have to be stuffy, and actually going to children's centres can provide really, really valuable insights. So I'm delighted that Heather's actually bagged that as well.
We've got a couple of points raised in the chat box. Somebody's asking about websites. What we'll do is make sure that there's a whole lot of other reference material which we'll send out and put on our website as well. Send out to you in the next few days. And there's also a question in the chat box. Somebody says, did I miss the answer to the poll in question? Is it a legal requirement? Kath?
And it is indeed a legal requirement, Gina. So thanks ever so much for actually highlighting that. So we've got a statutory requirement within the Health and Social Care Act of 2012 to actually involve the public within our commissioning processes, as well as within their individual care. So we are going to be held to account on how we're actually doing that. And the Care Quality Commission would be the vehicle to actually challenge us on these processes. And I think children and young people are often a forgotten element. So they're around about 22% of the population, 12.3 to 12.4 million of the population. It's absolutely critical that we don't forget then in our commissioning processes.
Thank you, Kath. There's a question from Julia, which everybody can see in the chat box. It's an open-ended question, I think, involving children and young people in commissioning. What's the best way in? Do commissioners open the door? I think Emily will cover some of that in her presentation at the practical level. But do you want to respond to that as well, Kath?
I think Emily's going to give us some great examples of how she's really making this a reality. But I think there are more and more clinical commissioning groups now who are actually beginning to do that. I think Shropshire is probably the best example that I can actually think of. Their accountable officer has really invested in children and young people's voice, and also in some intergenerational work as well. So actually bringing young people together with older people to actually think about a whole community's health needs as well. But I have to be honest, I think we're all learning, and it's really important, and I know Emily will reinforce this, that we actually focus on quality as well, and that we actually keep going back to children and young people and actually letting them know that we're listening and also we're responding to their input. We can't always necessarily do everything, but it is really important that we actually keep that communication open with them.
Thank you, Kath. Looks like the questions have finished just for the moment, but there's plenty of time at the end of the session for further questions, either in person or in the chat box. So I'm now going to pass over to Emily Roberts for the second half of the seminar, or the second half of the presenting bit of the seminar. And over to you, Emily.
Hello everybody. As you've been told, my name's Emily and I manage a Barnardo service. Quite an unusual service, so don't worry if you don't quite get it, but essentially we're subcontracted by North Bristol Trust, and we are about embedding children and young people's participation within community health services. So while it's within an acute trust, it runs all community services across Bristol and South Gloucestershire. So that's everything from health visiting, school nursing, mental health services, community paediatric services, allied health professionals. It's a massive service of 800 staff, and we are a service of 8 staff. So we are kind of doing it in partnership, and it's a collaboration. Okay, so what I would say, and I think, it's absolutely endorsing where Kath's coming. No one quite embodies passion in the way that Kath does, and I would say that participation does not work if you're going through the motions. It is a legal requirement, but it's empty if that's all it is, and the reason why it's a legal requirement is because it's the right thing to do. So the right thing to do for me comes first, and the legal requirement just gives a kind of oomph and a status to that right thing to do that's very much needed. I would say we're very, very fortunate in Bristol and South Gloucestershire. We've got incredible commissioners, and they've been with us every step of the way, as have the senior members of both the partnership, the Community Children's Health Partnership, and North Bristol Trust. There's a complete shared belief in what we're doing. It doesn't mean that we always agree and that we don't have differences of opinion and we're not absolutely scrutinised and challenged about what we're doing, but there is this kind of sense that we're all in it together and everybody's a stakeholder in this. The big challenge, of course, is that participation and involving children is very much a grassroots experience. It's not just about leaders and commissioners. And if we're going to turn children's rights into children's realities, then we need to really put a lot of emphasis on that. So that leads me, we come from it very much not terms of patient experience so much, which is Kath has kind of really majored on, but we talk about children and young people's participation. And when we first came to North Bristol Trust, it was like, well, where do we start? So we tried to enter into a dialogue with staff about, what would you like us to do? You know, we have this outcomes framework, so things we have to do, but is there anything that you've been burning and waiting for that opportunity? And we had quite a few responses back saying to us, we'd really love you to run a creche for us, so that our parents could participate in the groups that we run, so that their children can be looked after, and and that's a real barrier for us in terms of them being involved. And so we had to go absolutely back to the drawing board and think, okay, we don't clearly have a shared definition here about what participation is, and this is a kind of more recent example of a definition, and you need to review these and refine these things, but essentially we've worked this definition all the way through. So it's about sharing decision making, sharing power, all words that are very, very easy to say but very, very difficult to do. So it really gives a focus in terms of how you measure the success of what you're saying you're achieving. Okay, so that leads me very nicely onto the bit where you get to participate. This is an exercise I've done very frequently with my team and the partnership as a whole, because I think it's very much an emotional journey, this participation, and this is an emotional barometer as much as anything. And embedding participation, just for those people who may not be very clear about that, it's about, is participation everywhere? Is it permanent? Is it solid? Is it something that's here to stay, or does it feel incredibly fragile? So 10 is, this is incredible. We can't believe we've achieved children's participation the way we have. It's embedded and it's at the centre of all decision making. And number 1, and we've all been there, it's too difficult and we haven't even begun to make a start. So I'd love you all, if you possibly can, to put where you feel your organisation is. And it doesn't matter if you're a provider, you're a commissioner, you're a frontline member of staff, you're a senior leader. We've all got our own journey, and if you could start putting now, voting, whatever we call it.
The poll is open.
The poll is open.
Don't forget to do the submit button after you've clicked on your choice.
And as a kind of reassurance, really, when we did this in the early days, it probably changed from day to day. So it's very much a moment in time. We're not going to publish the results. You're not going to be held to account. It's essentially a bit of fun. And we were very much at the bottom of the scale when we started out. We probably stayed there for longer than we ever wanted to. But the bottom of the scale is just as important as the top of the scale.
We'll give the poll another 30 seconds or so, as over half of you have filled it in.
Okay, how does that feel?
72%.
So, thank you very...
Sorry, I've got to publish the poll, because I don't think you can see it yet.
Okay. Right, while Martin's working that out, I'm really grateful for you filling that in. It is good for understanding the mood and position of individuals as well as whole organisations, of teams, and it gives you a sense of who you need to look after. You need to look after the enthusiastic ones as well as the ones that are struggling, because people don't remain enthusiastic forever if they don't have that nurturing, and people need a bit of gentle pushing if they're at the bottom, or gentle kind of hand holding. Okay.
So you should see in front of you the results.
Right, so we've got nobody on 10. That's such a relief, because we're not on 10 either. And we've got a lot of people around the kind of the 4s, the kind of the 7, the 8. So well done to the kind of 7s and 8s. I think it's also well done for the people that have put their kind of more on the 1s and 2s. That's really useful to hear, because we've all got to start somewhere, and I think the most important thing is you understand why you are where you are, and that you're able to reflect on that and really get a sense of what that might mean to really embed this and move forward, because without that, I think it's quite hard to make a plan as to what it's going to take for this to become embedded. Does that feel okay? So thank you very much for that. Okay, so this is there's lots of different models about participation, and this is the one that we've used right from the beginning, and we continue to use to this day, and it's the whole systems approach, which is a model by the Social Care Institute for Excellence. And it's about looking at the whole structure and culture and practice and review of an organisation. So you're not just banging your head against a brick wall in one part of this and not really understanding how everything fits together. So I would say, and also Luca May Brady is with us today, and she's been supporting us in terms of how we further embed participation within our partnership, and she's running a kind of PhD research study where we are a case study within that, and we've developed a framework now which really helps us to much better monitor how we are progressing within this model that you see in front of you. So I'm going to just give you a few examples from each of these domains to give you an idea about what we've been doing. It's not the whole story, but it just does give you a picture. And I'm going to start with culture, because as Kath referred to herself, this is so important. If you ignore the culture of your team, your organisation, your service, this will come to haunt you later on, because this is about your attitude, the behaviours, the values, things that aren't necessarily easy to see, but they're very, very easy to feel. And this framework is about putting a mirror up to those behaviours and attitudes and kind of thinking, okay, so what are making that more visible? Okay, so in terms of the culture, I would say that our main things are we involve children and young people in the recruitment of all our staff who have any contact with patients. And it doesn't matter whether you're an administrator or whether you're the most senior clinician or manager, that you absolutely have that as part of your selection. And that is highly evaluated and scrutinised to make sure that that's good quality. All new staff attend mandatory participation training that's run by young people. And staff appraisals also include feedback from young people. We run kind of bulletins and ways of sharing good practice so that you get a kind of sharing so that things aren't done in isolation, and it's fully embedded within our clinical governance structures. And we have dedicated participation champions and a dedicated complaints process for young people. In terms of structure, so that's how you might kind of plan and develop the resources around participation. All services are expected to develop action plans to improve service user participation within this framework, and children and young people are encouraged to directly feedback about services in an absolute multitude of ways, because there is no one size fits all, and so we try and have lots of different angles in terms of our interaction with young people. And we have various formal celebrations so that we make sure that that's embedded within the work we do. Moving on to practice, one of our kind of big successes in terms of trying to get staff engaged is around transforming clinic environments and health settings to make sure they're incredibly welcoming, child-friendly, reassuring, kind of that they are calming and supportive places that really engages with the clinical work that you're doing, so it supports that clinical work, and it's a big win for staff as well as a big win for children and young people. We also have service user groups in place for those who want to be more actively involved in improving services, and also being able to evidence shared decision-making within the documentation of the individual work that young people are doing with services. And the review is essentially, no surprise to you, it's about how are we learning and evidencing from all the work that I just described. And you might come out with some very interesting evidence around the benefits of participation. We certainly had one clinician that said to us notably, participation has done more for this young person than a weekly session with me. Now, that does not mean to say that clinician was ineffective, but it demonstrates how powerful the being involved in the work like this can be for individual young people and children. And it's about being able to share that evidence and positive change and that learning with your service users, with your children, and with your staff and commissioners, of course. And that leads me on to the next slide. In terms of, this is really about trying to demonstrate that everyone is on their own journey, and do not underestimate the importance of people's individual journeys, as well as the organisational journey, whether that's commissioning or providing, the service, the children, young people themselves, and the individual member of staff. Everybody needs to be acknowledged for where they are. And I think what's really important about this is that we document the progress along the way, not just the end outcome, so that you can show that this thing is in progress rather than say, well, we haven't quite got there yet, because I think that this is the power of the journey, is being able to share some things. And in terms of the bit at the bottom, which is a young person, this young person came to us. She couldn't speak in public. She did everything through a project worker. She had enormous issues with anxiety. She never left her home. Very, very isolated. Now she's running training courses to whole roles of kind of education staff around mental health. I mean, completely smashing any achievable expectations that her clinician or anybody else thought that she was capable of. And very, very briefly, in terms of lessons learned, I would say your staff are so critical to this, and they're not always at the commissioners' meetings, the staff that I'm talking about. They're not always totally engaged in re-procurement or quarterly monitoring situations, but often it's the leaders that are attending those kinds of things, and the leaders are absolutely accountable and responsible, but it's the staff that bring it to life. It's the staff that change children's rights into children's realities. And I would say that we need to be evidencing how those staff are supported with time and other types of resources to make this possible. As in terms of staff engagement, when I'm talking about starting small and being meaningful, think about how this relates to things they're already doing. So I would say there's a really strong affiliation between children's rights and safeguarding, children's rights and the therapeutic alliance between the therapist and the child, and just really kind of building on what people already believe in. In terms of the kind of the bottom bit around evidence, I would say make your evidence exciting. It's very, very difficult when you're doing a report as a provider or commissioner to kind of really get across the excitement and the passion of participation. So we try and emphasise lots of photographs, lots of film, audio. We show films at all our commissioners' quarterly meetings. In fact, it's going on next door as we speak, and I know that they're showing a film at the moment about young parents in the Family Nurse Partnership new service that we've just launched. And, obviously case studies and just general feedback. But you don't always have to have young people and children in the room, although that's obviously got a place too. And I'm going to move on quickly now to just show, this is one example which is in relation to the work that we've been doing with Luca May Brady in terms of establishing a more kind of solid participation and strategy for the partnership. And the young people have been absolutely leading this with us and with clinical staff. And, they recently said to us, you know what, we don't want the label participation strategy anymore. We want to call it our mission. And it's about giving young people that freedom to say, okay, when you're communicating with young people, you know exactly what terms are going to mean the best for those, what is going to communicate this in the best way. And just being able to step back from that, I suppose. And then the last thing is just celebrate everything that you're doing well and share it to the max. And this is the one example of an event we ran earlier this year. Kath obviously is there, and that's why I've chosen it, because Kath's here presenting with me today. And it never ceases to amaze me how much pleasure and how many people smile when they've got success at their fingertips. And this is our biggest weapon, I suppose, is that we really invest in celebration for our young people and for staff that we work with, and we do that very much together. And, that pride really does see you through the more difficult times, and there certainly are those difficult times which I haven't so majored on in this presentation, but you need them, to really value the people that are doing this work. Thank you very much.
Thank you very much, Emily. So in a few moments, it's time for questions, and in fact that's now. So thank you, Emily and Kath, and we've got about 15 minutes before we round up for questions, which, as before, can be through the chat box, and Emily and Kath will both be looking at that, and I will be, to pick up any questions or comments there, or by raising your hand, which we didn't experience earlier on. So over to you.
Martin, it's Kath here. I'm just very aware that there's been a great deal of chat actually in the box, and something that's coming through really strongly is the work of Southampton and the work that they've actually been doing engaging children and young people. I know that Kath Patrick is on the line, and Kath, I don't know as to whether we could possibly unmute you and you could possibly share some of the work that you've been doing down in Southampton.
Okay. Kath is now on the line. Hello, Kath.
Hello.
Put on the spot there, aren't you?
I know, just a bit. Well, I'm juggling this at the moment in the middle of our CQC inspection, so I do apologise. I will have to go in a minute.
Our sympathies. We've just been through one of those.
Bless. Yeah, well, we've tried really hard here at Southampton to, we've tried lots of different ways to engage with our young people, and we're very conscious that it's quite hard because you have to cover for all the age groups, and disabilities. So we never use just one tool to sort of try and engage. We held a big engagement event about 18 months for the older child, and that was absolutely brilliant because we brought a graphic facilitator on the advice of Kath, which was brilliant, to come and help us record that, and we got a wealth of information on that, and that has formed the basis for us to go forward now with our youth partnership, which we're forming in joint coordination with the Trust Board, the Under-21 Trust Board members. And that we are planning to be a much more vocal and active group, who will influence trust agendas and actually will, badger trusts, for the views of children and young people to get it a stronger voice for them, which we are a children's hospital, but we also are part of a very big adult trust as well. So it's important that we get their voice heard. The younger child, we tried little innovative ways. I know Kath knows my secret agent work, which is recruited by the play team, which captures the younger child's voice by them having a little pack of goodies, and they're asked to be our little agents, looking at what we do well and what we don't do so well. And their feedback is fed into our governance reports too. And we're also at the moment doing our Friends and Family for Children and Young People. We're doing a pilot with PICA in joint coordination with BARTS, who are also piloting at the moment. And that, I have to say, has gone really well. The form that PICA have devised is simple and easy to use, so we're quite excited using that, and hopefully we'll be rolling that out as a standard for all feedback for children and young people. So that's a little bit of a flavour. There's lots of other things we're doing, mad little ideas like pants and tops, which we pinched off Twitter, and that was Royal Manchester's idea, and we've done that. And the other thing which we're developing is the butterflies to caterpillars, which is the children write their view on I've got to think now, on the caterpillar, and then the change that we make is then written by the staff on the butterfly. And that's something we haven't got rolled out at the moment, but we're working on.
May I ask?
Needed to fly. Thank you, Kath.
Brilliant.
Sounds like
brilliant.
you're busy.
Yeah.
I've been busy today too. So thanks for coming to the seminar. It feels to me like there's lots of ideas here which people want to share or want to find out how to share. So I think either at the very end, Kath and Emily can talk about that, but also we'll think about what other links we can send out so that you can share some of this information. And I will also assume that everybody on the call or in the seminar is happy to have their emails shared in a joint email. Let me know if you're not. And that will then create the opportunity for you to contact each other outside of the seminar. So thanks again, Kath. We've had a couple, 2 or 3 questions, which might be for everybody here, around payment. I mean, it's a practical thing. It's one of probably many practical things around engaging young people. Emily, have you got a response?
It is complex, but what we try and do is we try and kind of create a kind of distinction between what we pay and what we don't pay. We never pay people cash. They're not on a payroll. They're not even technically kind of volunteers, and because obviously Barnardo has a very strict structure for our volunteers, they're very much free to kind of be involved or not be involved as is convenient and as works for them. Where we involve young people where they're giving up a reasonable amount of their time and they're doing something which is essentially something not that you'd expect a paid worker to do, but they're doing presentations, or they're involved in putting together kind of strategy and things like that. Where we don't involve them is if we're putting on a big art workshop and things like that, or they're attending service user groups where we're paying. We always pay for their expenses, and we provide lots of kind of refreshments and fun things for them to do. We don't pay for that. But we do have a kind of structure which I can kind of happy to share outside of this webinar.
Thank you, Emily. And Kath, do you have a view of experience or ethical?
I mean, I think it's interesting, and it's been really interesting actually reading the chat on this. We certainly don't pay the children and young people who are part of the NHS Youth Forum. What we do, however, is actually cover expenses. So we ensure that that's all paid up front so that the children and young people aren't out of pocket. What they really do value, however, is feedback and thank you letters and references that actually go into their personal profiles as well. So at the end of any event, then we'll make sure that a formal thank you actually goes to them so that they've got some acknowledgement of that. But it is a really challenging area. I absolutely appreciate that.
Thank you. Any other topics coming up? I haven't spotted any yet, but please continue now to ask a question or pose a chat box.
While we're waiting for that, I would agree with what Kate Mansfield is saying around pizza.
Yeah.
We never order enough pizza, and I think it's all about also asking the young people what they want from this. I think there is a sense of do they leave feeling like they've got something out of this that they want, as well as what Kath is saying, which is I think should be really standard for everybody, that they get an official thank you and acknowledgement. But I think if people feel that they're being really listened to and the feedback is timely and they feel that influence, often that's a kind of different type of payment.
Thank you, Emily. I see Julia. Julia, ask a question.
Just a quick question from me. It concerns.
Julia, could you just introduce where you're from, and then?
Yes, I'm from Together for Short Lives, a national organisation supporting children and families with life-limiting conditions. So I'm one step removed from service delivery, but my personal role is involvement. And my question refers to, we've got a young group of young adults with life-limiting conditions who we call the Young Avengers. They chose the name themselves. And they do quite a lot of speaking for us. And just at a recent meeting, the concept of starting up some sort of social enterprise, looking at preparing for adulthood. They're never likely to secure employment, yet they're working on our behalf and being the voice and sharing their experience with our partners. And I just wondered if there's any models out there of young people with complex health needs who have almost participate as a job, or is this going into sort of another dimension of it all?
Kath, do you have any sense of sort of? I suppose we're talking about the limits.
It's really interesting, Julia, and a really critical point actually for further exploration, I think. I've certainly come across young people, for example, with autism, who have actually gone into business and actually sort of, are quite prepared to actually go and train teachers as well as healthcare staff. And actually request payment for that, because they are providing a very high quality consultancy. So there's certainly one young man who immediately comes to mind. But I also think there's a wider piece of work at NHS England going on at the moment, actually looking at the role of patient leadership and the Participation Academy. And sort of, this is an opportunity for further discussion in this area. So it would be really useful, actually, to sort of link you into those discussions, Julia, so that we could pursue this further.
In terms of my experience of this, I know the IAP initiative, which has improved access to psychological therapies, participation in terms of NHS England Department of Health is led by an organisation called GIFT, and they do pay young people as sessional workers. Obviously, this is national work. They're doing lots of presentations. It's probably requiring a lot of their time. I mean, I know I think we need to be mindful that certainly a lot of the older young people that we might work with, they're not fit for work. They are on benefits. And if you are doing if you even are doing so many volunteer hours, they can stop your benefits. And you need to be really careful on an individual basis about the decisions that you're making, and that they are within the remits of people's kind of allowance. And it's said in a certain way. I think you can work so many hours if it's of therapeutic benefit, but if you go over that, then it's problematic, and you just be careful in terms of the implications that could be unwittingly for those young people.
Right, thank you. We've got 2 or 3 more question areas coming up, which we can, I think, just about fit in. Emily, what are you saying yes to? Which question do you want to respond to?
The UNCRC. Do we need to do more to promote the UNCRC, United Nations Convention on the Rights of the Child, and children's rights-based approach to participation in the NHS? Yes. I mean, still there aren't enough people who know what the UNCRC is. I mean, I'd like to think if you asked all the staff in the partnership these days, they know that it exists. It does not necessarily exist in people's clinical training, though. And I come from a social work background. It did exist in my training. I don't know whether it still exists now. And that was a major turning point for me. But I think you don't assume that people know about this, and they're not so that where they're coming from could be potentially quite at odds with the children's rights approach. It's not to say they don't want the best for children, but I think if you come from very much a point of view where you're paternalistic in your attitude to the work you do, and you're very much seeing yourself as the expert, and that people are passive recipients of what you have to offer, then this is a major challenge to how services are going to develop and change in the future. So I would say a big yes to that, and we do bring everything back to the UNCRC because it is an international right. It's not just something we're making up or is particular to our country. It should transcend all national barriers, really.
Thank you, Emily. Can I just say we've got, I think, 2 question areas, so we probably can just about fit those into the next 5 minutes. 2 question areas that I picked out from the chat box. And one is perhaps echoes other people. It's from Hazel. who I think is from the hospice here in Bristol. It's something like this, Hazel, isn't it? Where can we find people to help us do this and get participation in commissioning? And Steve has very helpfully given one reply, which is, don't forget Health Watch. But I wonder if Kath or Emily, you'd like to respond to that. Just where do we, locally, wherever I am, where do we go?
I think that's a real issue, actually. Oh, sorry, Kathy. You go, Kath.
No, sorry. I was just going to say local authorities are actually generally incredibly helpful, and I would actually get directly in touch with them and actually just check. And I appreciate there are some significant challenges at the moment with regard to financial sort of changes in local authorities, but actually generally they all do actually have youth participation officers, and they are great contacts for local areas. And I know Emily will actually go on to say, actually don't forget about the voluntary sector as well, because there are some great sort of links that we can actually be making with those organisations. So up in the north, for example, there's Investing in Children, which is a social enterprise, which is actually made up of young people, and a local CCG actually commissioned them to do a specific piece of work on self-harm, for example. And I know we've got Chili Pep up in Sheffield as well. So there are these groups around the country. So I'll hand back over to you, Emily.
Hi, yes, I suppose rather than just give a bit more of a generic answer, I want to pick up with one person who was talking about worth engaging with your local health watch. And I would say that I would absolutely endorse that, because while your local authority and obviously your local voluntary sector, which is different for each community, so it's quite hard to be so specific about that, your health watch should be working with all these people. And if you are unclear about, what exactly is going on, they should either know about it or you should be able to work together to find out, because there is something about how this is coordinated in one place. We're certainly doing much more collaboration with our local health watch than we ever did, and I know everything varies across the country, but I think that's a brilliant place to start, and there's an opportunity for some partnership working there in terms of if it doesn't feel like that there's a database that you can kind of create that, really. And the relationships, use the relationship. I mean, I've worked in Bristol a long time now, so I've got and had many different types of roles. So you've got existing relationships, and don't be afraid to go to those early help services, those social work services, as well as within health and the voluntary sector.
Thank you very much. And the other area, just in the last 2 minutes, really, that I see David. Hello, David. I'm going to unmute you. Hello, can you hear?
Hello.
Hello, David. I think we can all hear you. Your question was around GPs, and is that GPs in the surgery or GPs as commissioners? Do you want to just amplify?
Well, both. I'm very aware that in this line of work we tend to talk a lot about events and topic-based consultations. I'm quite interested in the concept of building listening organisations, so that feedback within the GP's surgery about a young person or a carer's experience through the wider health service then actually trickles on into the whole commissioning cycle, so that we're not just dependent on these very specific events or periods of consultation. We actually have got our receptors out at all times. And I just wondered, we've had a little bit of positive experience with that on the Isle of Wight, where I am, with GPs able to give informal feedback via their desktops. But I just wondered how other people are getting on with this idea of sort of a listening organisation.
Thank you. I'm just going to ask Kath and Emily to respond to that. And I can see you point very clearly, David, it's the difference really between episodic consultation, which CCGs are getting increasingly good at, closing hospitals, for example. I've been involved in that, and the concept you've outlined. Emily?
I don't have experience of what you're talking about in terms of GPs giving their direct feedback about the experiences that their young people are having. Is that what you're saying?
I mean, that's just an example of a health worker, really. But obviously, because they're supposed to be in the, at the heart of CCG, that's why it came to mind. But health workers generally.
I'm just aware of the opportunities actually actually that the Friends and Family Test actually offers us in terms of actually shifting the culture. And whilst I appreciate that the Friends and Family Test is not perfect in any way, shape or form, now that it's actually being embedded in GP practices and actually seeking feedback consistently, how was it for you? What I think is so key is that actually within primary care we make sure that children and young people actually have an opportunity to actually feed back. So I think the FFT is one way. I think we've also got examples in Birmingham Children's Hospital where they've actually done an online app so that they can scan the QRS code within the outpatient area or in an inpatient area and actually provide immediate feedback that goes directly to that clinician who's in charge of that particular clinical area for them to respond. So I think we need to get much more IT literate, which could then actually really ensure that we really are becoming true listening organisations at a very practical level on a day-to-day basis, but actually we're feeding that into our commissioning processes as well. So if you haven't had a look at the Birmingham Children's Hospital app, I definitely recommend having a peek at that.
Yeah, can I just raise one more thing in terms of our GP surgeries, because obviously that's the gateway to everything, as we know, not absolutely everything, but most things, and there is an expectation on GP surgeries that they achieve a young people friendly status, which is essentially the Department of Health, you're welcome, and I think that is quite a powerful process for those surgeries. It's not episodic, it happens over quite a long period of time. They're expected to show evidence on how they've changed their services in relation to young people's feedback, as well as a whole other set of quality criteria. And the other thing that we do is that we audit care pathways for long-term conditions in relation to the whole experience from pre-referral to referral right through to the other end and out into transition. And so that very clearly talks about that visit to the GP, trying to get heard at that point, and then out the other end in terms of getting into a service. And this is really good evidence for us in terms of our relationships with our GPs and being able to get a change that end and improving partnership between the service provider and the referrer. And yes, so I think that we've had success there, certainly with eating disorders and other services.
Thank you, Emily. I'm going to draw us to a close. Just to give us 60 seconds to finish off. It's been a really exciting experience listening to you and looking at your contributions in the chat box. I've noticed lots and lots of, I can tell you this, I'd like to meet up with you or talk to you. So definitely we'll, as the slide says here, we'll circulate the presentation. Do look on our website for other ones which are coming up as well. We'll obviously give you lots of encouragement to get in contact with each other outside of today's 1 hour seminar. And I'm just going to pass you over firstly to Emily to say thank you and goodbye, and then over to Kath to say the same. Emily, last word.
Okay, yes, thank you everybody. It was lovely to see some familiar names there as well as new names to me, and thank you to Chenzina for your last comment around BME young people in terms of the barriers they face, and you know that is something we all need to focus on. And thank you very much. This is my first webinar experience, and in terms of presenting and being a participant, so thank you very much.
Thank you, and over to Kath to finish.
I just think the energy from this morning has been absolutely amazing. I think we just need to keep this alive now, keep the conversation actually going. There's so much good stuff actually happening. So please do keep tweeting. CYP Voices